How to avoid a neurologist. An apple a day may keep the doctor away, but not a neurologist. The nervous system is vulnerable from the top of the head to the tips of the toes. The cells that constitute the nervous system are susceptible to an astonishing variety of insults. This explains the diversity and number of neurological diseases. That's why medical students and doctors find neurology scary. Many neurological diseases, we can do absolutely nothing to guard against. This is the case especially with genetic neurological diseases. Unless we find a way of choosing our parents wisely. Only way of improving our defenses include exercising regularly, eating healthily, and stop smoking. Even these have their limitations against many neurological disorders. There are measures we can take to shield ourselves against some avoidable neurological conditions. Many of these arise because of activities we engage in, often mindless of their consequences. Anger is an unpredictable negative emotion, which hardly ever serves any useful purpose. Anger is a recognized trigger of stroke. Excessive neck extension, as occurs at the hairdresser's or the chiropractor, can stretch and tear the inner lining of the neck artery. This painful tear called a dissection, and it allows forming a blood clot. The clot may dislodge and travel up the blood vessel and blocks blood flow to the brain. This results in the beauty parlor stroke syndrome. Additional support for the neck reduces this risk. Habitual crossed-leg sitting puts your perineal nerve at risk of compression. The result is foot drop. Prolonged squatting and also sitting in the yoga lotus position causes a similar damage. It's called strawberry picker's foot drop. Don't stay too long on the toilet seat. The sciatic nerve is the largest peripheral nerve in the body. It traverses the buttock on its way to innervate most of the lower limb muscles. It is vulnerable to prolonged sitting on hard surfaces. This is called toilet seat neuropathy. You could of course have your toilet seat nicely padded. You may also protect your sciatic nerve by not sitting on thick wallets in your back pocket. It is trendy to have nice six-pack or firm pectorals, but this may come at a price. As the muscles get stronger and bulkier, they may compress the nerves, which pass through them. Most vulnerable are the thoracodorsal, the suprascapular, and the pectoral nerves. A shrunken pectoral muscle on one side is sure evidence that you have overdone it. Athletic sports that involve excessive upper limb movements may stretch and compress the nerves. Particularly vulnerable is the axillary nerve, which supplies the muscles you need to lift your arm away from your body. The culprit sports include volleyball, javelin, rock climbing, and rugby. It is so convenient to sling a backpack over the shoulder. But it is dangerous if you overload it. This is because the heavy weight of a backpack may damage the brachial plexus, the large network of nerves that innervate the upper limb. The resulting limp upper arm is called rucksack paralysis. The wrist is the gateway to three important nerves, all vulnerable to compression. External pressure on the wrist particularly picks on the superficial branch of the radial nerve. The resulting handcuff palsy causes pain and tingling over the back of the hand. A similar effect may result from tight wristwatches and bracelets. A good reason to go bare below the elbows. To avoid the so-called cyclist's palsy, take care when riding. Don't hold your bicycle handlebars too tightly. This is to protect your ulnar nerve, which traverses the wrist, just where the cycle handlebars would compress it. This causes paralysis of many of the small muscles of the hand, sparing only the thumb. Don't tighten your belt excessively. The victim nerve this time is a branch of the femoral nerve, the second largest nerve of the lower limb. This nerve migrates from the abdomen into the thigh by squeezing just under the belt line. It is vulnerable to compression here, and the result is myalgia peristatica. This is a fairly common condition, easily recognized by a combination of pain, tingling, and numbness over a well-demarcated patch on the outer thigh. Wearing skinny jeans is another recognized cause, as are prolonged sitting and weight gain. Choosing the wrong ski boots may not just mess up your skiing holiday. It could result in compression of the perineal nerve around the ankle. This causes tingling over the foot. This may persist long after you have discarded the offending boots. Do not fail a hanging attempt. The nerves vulnerable to the hangman's noose are the greater auricular nerves. These nerves transmit sensation from the ears, not a major problem if the hanging is successful. If the attempt fails, however, be prepared for numb ears in resurrection. Thank you.